Hello, Assalamu alaikum.
Hi, Assalamu alaikum. Hello.
Walaikum assalam. So, you are welcome, Dr. Taimoor. First of all, I would like to introduce my audience that today we are having Dr. Taimoor Hameed, who is working as an emergency medicine lead registrar in NHS. And he did his MBBS from Sharif Medical College, Lahore, Pakistan, and did Plab in 2019. After that, he joined emergency medicine program at West Hertfordshire NHS Trust in 2020 and has completed his MRCEM then. He is also advanced life support instructor and experienced in point of care ultrasound. So I'm delighted to have you in our live podcast today, Dr. Taimoor, and you are heartily welcome by the team of MedExam Expert.
Thank you so much. Thank you for the elaborate introduction, Mariam. Thank you.
You are welcome. So, although I have introduced you, so do you think that there is still anything missing in your introduction? So, I would like to um, say that you should introduce yourself to in our today's podcast.
Mariam, I think you've covered everything, but just briefly. So my name is Taimoor. I'm working as the lead registrar in NHS. My parent trust is West Hertfordshire NHS. It's very close to London. And I also do locum shifts here and there in the big hospitals and trusts of London.
Okay,
And I
that's
graduated from,
amazing.
but I've been in UK since 2019, and I've completed my
Mm-hmm.
exams now.
Okay, that's brilliant, Dr. Taimoor. Okay, so can you please share your story of efforts and your journey of MRCEM exam? So our aspirants basically want to know about this exam first, and they are eagerly waiting for your story of success and your efforts for this exam.
Okay, yes. So yeah, I'll try to be as brief as possible.
Yeah, exactly. Yeah.
Basically, what happened is that I came in UK in 2019, and I came here with an aim to become a cardiologist. Very honestly speaking, to begin with.
Okay.
Then I took up a non-training job in emergency department of Watford General Hospital. It's one of the district general hospitals here. And when I started doing my non-training job here, I absolutely fell in love with the specialty. I had no idea at that time that emergency medicine itself exists as a specialty, because it doesn't usually at that back then there wasn't any concept of emergency medicine in Pakistan at all, and none of my seniors guided me about that. So when I saw how emergency medicine is and what it is about, I fell in love with the specialty, and then I entered the training program basically. When I entered the formal training program, I started asking my seniors about what to do next and how to progress and how to gain more competencies in this specialty. So all these exams and everything that are involved in the curriculum and the training program, they are all basically designed in a way to teach you and to make you competent in that specialty. That is the whole purpose of that exam. Yeah. So back then, it was slightly different. Back then, when I started emergency medicine, back then the program was slightly different. We did not had MRCEM and FRCEM separately in UK.
Mm-hmm.
Uh, I'm talking about 2020. Uh,
Okay.
Back then, you had to sit in your FRCEM primary, which was fellowship exam, and then you had to sit in subsequent exams to get your fellowship. There wasn't an option to get a membership and then a fellowship. But when I sat in my first exam, which was the Fellowship of the Royal College of Emergency Medicine primary exam, FRCEM primary, our College decided to separate the fellowship from membership. Okay.
Okay. Okay.
And so they started giving us an option that now what you can do is that you can, like other specialties, get a membership first, get more expertise, more competencies, and then sit in your fellowship later. So I did the same. I did my FRChem primary, and then I started studying for my next exam, which was MRCEM SBA. I did that, which was MRCEM Intermediate SBA. As soon as I was done with that, because I was already practicing in NHS and I was quite comfortable in dealing with the clinical scenarios in everyday practice, I decided to straight away sit in my MRCEM OSCE exam. It didn't take me much to practice for it because I was practicing in the same environment and setup So I literally prepared for a couple of months for my MRCEM OSCE, which is the final OSCE for your membership exam. And then I sat in that exam here in London. And Alhamdulillah, I managed to pass that exam in first attempt, like rest of the exams. And then I was granted the diploma of the membership of the Royal College of Emergency Medicine.
Okay, that's very amazing, and that's very brilliant, Dr. Taimoor, I must say. So, as you have told us about your journey, so let us talk about some of the exam overview. As you have told us that there are two kind of exam, like MRCEM and FRCEM. So, the first question here is, what are the requirements of MRCEM and what are the requirements of FRCEM?
Brilliant. Okay, so you have to first understand that MRCEM is membership and FRCEM is fellowship. Yeah, as the name
Okay.
says. Okay, so you
Yeah.
have to be a member before you are eligible to become a fellow. Okay.
Exactly.
The membership exams are designed in such a way that they will make you competent enough to be at a senior registrar level, okay, an SR level or a lead registrar level. But you can't be a consultant until you are a fellow of the Royal College. Okay. So
Okay.
the MRCEM will take you all the way up to the senior registrar level. Okay. Now, MRCEM itself is divided into three different parts. Okay. The first part is MRCEM Primary Select Best Answer, or otherwise known as MRCEM Primary SBA. Okay.
Okay.
The eligibility criteria for that exam is very straightforward. All you need to do is to hold a primary medical qualification, which is basically your MBBS degree. That's all you need. Okay. If you got MBBS degree, you are eligible to sit in that exam. All you need to do is to make an account and get an associate membership of the Royal College of Emergency Medicine. You can do that online, and then you can pay for the fee and prepare for the exam and sit in it. That's the eligibility criteria for your MRCEM primary. Then the
Mhm.
eligibility criteria for MRCEM intermediate is slightly different. So you need to have, number one, the primary qualification, that's your degree. Then you need to have house job experience or foundation year experience. Okay. And then you need to have your MRCEM primary qualification. Okay. So these three are the eligibility criteria for MRCEM intermediate: your primary medical qualification, your MRCEM primary, and at least house job. Then you become
Okay.
eligible to get in your intermediate. Okay. But the criteria, the eligibility criteria for OSCE is even a bit more complicated. Okay.
Okay.
Uh,
Okay.
the Royal College won't let you sit in the OSCE until you are practicing at a senior level in NHS. Okay.
Okay.
So they have changed, they made the criteria a bit complicated. So you need to have MRCEM primary, you need to have MRCEM intermediate,
Yeah.
then you need to have your house job. And apart from your house job, on top of it, you need to have 36 months of emergency medicine experience. And out of those 36 months, you need to have at least 6 months of registrar level experience in NHS. And then they would let you sit in your MRCEM OSCE exam. Okay.
Okay.
So in
So,
total, you need to at least have 36 months of emergency medicine experience.
okay. So, that's very amazing that you have elaborated all the aspirants in that wonderful way. So, Dr. Taimoor, there comes a question. There is a live question that is MBBS degree is only the validity for is only the eligibility to sit in the MRCEM primary. Like the candidate is asking if there is not requirement of house job or internship of for 1 year. Isn't like that?
No, it's not. It's not like that. The foundation year is the eligibility criteria for intermediate exam.
Okay. Okay. Okay.
Primary, the Royal College will not ask for any house job experience or certification. Okay.
Okay. Okay.
For
Okay.
primary, you can sit just by using your primary medical qualification. It is very clearly mentioned on the Royal College's website.
Okay, so I guess now she's very clear. So now there comes another question like, what about the validity of exam? As you have told us that there are three parts. So between part one and part two, how much there is a gap time and gap period like a candidate may take, like when your exam is going to expire. So can you please tell us the idea about the validity of exam?
So the Royal College itself has not mentioned any such validity of the
Mm-hmm.
exams. Okay? It's unlike other Royal Colleges. Now the thing with the Royal College of Emergency Medicine is they are very flexible. They are very user friendly, unlike other Royal Colleges, because they want to
Okay.
promote their training program. And because it's a new specialty, I used to call emergency medicine as a baby specialty because we're quite in the infantile phase. Yeah. So the
Okay,
world
okay.
started to understand the importance of emergency medicine. And to make it user friendly, our Royal College is coming up with certain things which make it look lucrative and attractive to new graduates. So that is why at this point of time, they haven't mentioned any validity period of any
Mm-hmm.
gap that you can take. So
Okay, so what do you suggest that what a candidate should do? Like, if there is nothing mentioned, like on the MRCEM site,
Mhm.
original website, then
Mhm.
what is your suggestion in taking all these three exams?
So, ideal scenario is that you take one exam a year, which is doable, which is
Okay,
doable. Okay, so you can do MRCEM primary, and the curriculum of MRCEM primary is your basic sciences curriculum. Okay,
okay,
and it is basically what you learn in your final year med school. Okay,
okay,
or even before that. So it involves anatomy, physiology, a bit of gynecology, and all of that. Yeah. So the curriculum is very elaborately mentioned on the Royal College's website. It is the 2021 emergency medicine curriculum that they
okay,
are currently following. Okay. So the primary is all basic sciences. So nothing to worry about. You can do it at the end of your either house job if you want, or in the middle of your house job. You can do it whenever you get enough time. But you need to
okay.
study for it. It's an expensive exam, like all Royal Colleges exams. So I would
Mm-hmm.
definitely recommend everyone to first study thoroughly for it and then sit in it. Okay. Yeah.
Okay, so can you tell us about the time frame in which the exam is being prepared?
So it will take you 6 months. I'll be very
Okay,
honest.
straight
It
away
will
six
take
months.
you
Yeah.
6 months to prepare for the exam. Okay. If you want to pass it in first attempt, then I would recommend that you give 6 months for your primary exam. Reason
Okay, okay.
I say 6 months is because when you're at the end of your house job, you usually forget your basic sciences that you have.
Exactly. The thing is, yeah, that's
Yes,
very
you have
true.
to revise. Okay, so
Yeah.
so primary is usually a slightly difficult than intermediate. I'll talk about intermediate in a minute, but it will take you 6 months to prepare for primary.
Okay, so there comes another question like, what is the best question bank for preparation of MRCEM exam?
Very good. So there are many options available online. Okay,
Okay,
but I can only suggest the one that I have used, and that is the MRCEM Success. Okay,
okay.
it's a website, and they also have a mobile portal. And you have to pay for a subscription. They have multiple options to get 3 month or 6 month subscription. I took 3 months and then I extended it. And so the platform itself is very user friendly and it's very self-explanatory. It's basically past questions, and then they will
Mm-hmm.
elaborate the answers, and then basically the entire exam will come through from that website.
Okay, so there comes another question about the venues and the test center of the MRCEM exam. So can you tell us about and give us a rough idea like on which centers this exam is being conducted?
Okay, so I did all my exams in UK,
Okay.
and so there is our Royal College's building. It's in Octavia House in central
Mm-hmm.
London, right next to the Royal College of Gynecologists. Right next
Okay.
to it, basically, but it's not as big as the Royal College of Gynecology. It's a small one, but it's a beautiful building. So I did my intermediate and my OSCE there. And my primary was because it was COVID days, so there was an option to do primary at home. So I did my MRChem primary while I was sitting at home. I think they are not no more offering you that option to do it remotely. So you have to go and sit in an examination center, and there are multiple examination centers worldwide. So Pearson
Mm-hmm.
View is the company. You can go to
Okay.
the website Pearson View, VUE View.
Yeah, yeah.
They will tell you the various venues where you can sit, and you can just give your local address and see what is the nearest one for you.
Okay. So thank you so much for another explanation of the exam centers. So Dr. Taimoor, can you please tell us that how many years is emergency medicine in UK for the residency? Like the candidate is asking for the number of years of residency in emergency medicine, which is accepted in UK.
Okay, so straightforward answer is 6 years. Okay,
Okay.
so 6 year, the entire emergency medicine training program is 6 years long. Okay,
Mm-hmm.
now having said that, there are some shortcuts.
Okay.
Shortcut in terms, as I said, that Royal College is coming up with plans to make this specialty a bit attractive. So they have come up with some shortcuts now. I wouldn't say shortcuts. They wouldn't cut the time period, but you can enter the training program at different stages now. Okay. So
Okay.
you can either start from the very beginning. That would be your ST1. Okay. And that would be basically your acute care, ACCS, basically.
Okay.
Basically 3 years long. The first 3 years are in acute medicine. So they will rotate you in different other specialties for 3 years, and they call it ACCS. Okay, so you start from year 1, 2, and 3. Okay, and then and by the time you're finished with 3, you have an option to either continue as a non-training registrar, or you can enter the higher specialty training, which is 3 more years. Okay. And then that would be cumulatively 6 years. So 3 years in ACCS and 3 years in higher specialty training. And at the end of that, you get CCT. Okay, option number 1.
Okay.
The other option is that if you have already got non-training experience in working in emergency medicine, either in UK or abroad, you can directly enter from the 3rd year onward. So you can skip the first 2 years, and you can start as an ST3 registrar and continue your training from there onward. So 3 years, ST3, 4, 5, 6, so 4 years from there. Okay.
Okay.
So the 2 options now, you can either start from the beginning or enter through the middle of the training, and continue from there.
Okay, so thank you so much again. And then there is a question like, is MRCEM recognized globally?
Very good question. It is definitely recognized globally. Like all
Okay.
the other specialities, all the other Royal Colleges, our Royal College is also recognized globally. Now, by globally, I mean world is massive. Yeah. So I wouldn't say that it is recognized in every single part of the world. For example, in US currently, it's not, they have their own residency program. Okay.
Okay.
So if you apply for a training in the US residency program, and if you have already trained in UK, then you do get some extra points out of it. Okay. Your
Okay,
application
that's
will be
brilliant. Yeah.
considered above other candidates. If you've got fellowship and or membership, then obviously they will consider you before other people. But as a specialty exam, it is mainly recognized in UK, Ireland, then Middle East countries, including the Saudi Arabia and UAE. It's also recognized in Malaysia, India, and now in Pakistan, and other African countries. But apart from US, it's recognized most of the Europe and Asia and Africa.
Okay, so thank you again. And then there is a question like, let's have talk on the success rate of both of these exams, like FRCEM and MRCEM.
Okay, so the success rate, the figures that I was able to find out are slightly different to what I believe. I think the success rate might be a bit better than what they say on internet, because my colleagues and my friends, most of the ones that I've known over the past few years, they all managed to pass it in first attempt. But the official website gives you a number of somewhere between 28 to 35% for MRCEM exams, and for FRCEM exam, it's somewhere around 25% success rate. But having said that, I don't know where they got that value from. I think it is a very much doable exam. And I haven't come across anyone who has to attempt it multiple times.
Okay. So, as you have told us about the requirements and the eligibility of MRCEM, so now there comes a question of requirements and eligibility of FRCEM. As you have told us, like we know that one is the fellowship exam and the other one is the membership exam. But now the question arises for the requirements of FRCEM.
Okay. Now, so FRCEM is slightly different than MRCEM. Now, there are, unlike some specialties where you cannot get a fellowship if you are not in a formal training program, the emergency medicine is slightly different. So if you cannot get FRCS or FRCP if you are not trained in a residency program, but you can get FRCEM if you are not in a formal training program. Okay, if you are working as a non-trainee doctor, if you are, while working as a non-trainee doctor, if you are supported by a clinical and educational supervisor, and if you
Mm-hmm.
are maintaining your own portfolio, the Royal College's portfolio and logbooks, you are eligible to sit in your fellowship exams. Okay. So there
Okay.
are many non-trainee doctors who are fellow of the Royal College of Emergency Medicine. Okay. So the eligibility criteria for, so after you are done with your 3 MRCEM exams, primary, intermediate, and OSCE, you have 2 more exams for fellowship, to get fellowship. Okay. You have got FRChem SBA, that is FRChem Select Best Answer. Okay. And
Mm-hmm.
then the final OSCE for FRChem. Okay, so 2 more exams after your MRCEM. So the eligibility criteria, so you can do the last 2 exams in any order at all, the fellowship exam. You
Okay.
can sit in OSCE first if you want, or you can sit in the select best answer, the multiple choice question. Okay, any
Okay.
order at all. Okay, but what you need is your MRCEM diploma, experience in emergency medicine, and then a letter from your supervisor that they are happy
Okay.
for you to sit in the fellowship exam.
Okay. So, Dr. Taimoor, you have told us about the best question bank for the MRCEM primary. Now, question comes about the MRCEM exam intermediate and the OSCE,
Okay.
because you told us that now you are going to proceed about these 2 exams. So,
Okay.
please tell us that what is the best preparation material for both of these exams?
Okay, sure. So MRCEM Success website covers both part of your MRCEM exam. So it will cover your primary. So they have got a question
Mm-hmm.
bank for primary, and they also have a very good question bank for intermediate. Okay.
Okay.
But for intermediate, you might have to use a couple of extra resources. Okay.
Okay.
Everyone has got different preferences. Okay. But I like 2 books. I use 2 books as a textbook for emergency medicine. One is the Oxford Handbook of Emergency Medicine, and then I use Tentinalis. So there are 2
Okay.
books easily available in PDF form, downloadable, or you can get the hard copies and you can buy them. So apart from the MRCEM Success Intermediate Question Bank, I would advise people to use textbooks, which would be the Oxford Handbook of Emergency Medicine or Tentinalis, and the third and the core curriculum of the RCEM is
Mm-hmm.
another very good source that you can use. So if you have access to the RCEM learning website, which you will get a free access if you are a member of the Royal College of Emergency Medicine, an associate member, um,
Okay.
they will give you access to the RCEM learning website. And on that learning website, there is a clinical curriculum. So all you have to do is to go through that curriculum, and if it will also help you in preparation of your exams for
Okay,
intermediate.
so yeah, thank you very much and other for another detailed explanation. As you are telling us that if you are associate member of the RCEM, so is there any eligibility for it too? Like, who can be the associate member of the college?
So there is no eligibility to become associate member of
Okay.
I think any college at all. So you can just get to go to their website, and if you've got a primary medical qualification, you
Mm-hmm.
can pay money and basically become a member of them. That's an associate membership. So it gives you some perks, like it gives you access to their online learning resources. It gives you
Okay.
access to their online events, their conferences and stuff. So I think, basically, most of the Royal Colleges offer you this option to become an associate member just by applying.
Okay, so yeah, the simple answer is investing money to become a
Yeah.
member. Okay, okay, Dr. Taimoor, as you have done with Plab and the MRCEM as well, so what do you think that which one has better chance for securing a job in UK? Moreover, which one is more valuable in the long run?
Okay.
What do you
So
think that?
it depends what you want to do in future. If you are
Okay,
sure that you want to pursue emergency medicine as a specialty, and I would like everyone to do that, um,
okay,
then I think if you do MRCAM before coming to UK, it will give you more options, and
okay.
it will give you more weightage to your application. Okay, if you've got
Mm-hmm.
membership of a Royal College, and if you have been practicing emergency medicine at any level back home in Pakistan or wherever you are, then it will obviously give you more weightage and will help you securing your first job with NHS. Okay, but if you are not sure yet, then definitely go for Plab exams, because then you can come and start working at any level in NHS and then make up your mind what you want to do in future.
Okay, thank you. So then there comes a question like one person is asking that if anybody is doing residency, like Pakistani residency, and he's doing his postgraduate residency in Pakistan for the medicine, and if he's eligible for the MRCEM primary and the MRCEM intermediate, then at what level he's going to secure his job in UK?
Okay. So if you are done with your, if you have got clinical experience back home, and if a part of
Mm-hmm.
your clinical experience is in working in accident and emergency departments in Pakistan, then you can use that experience, and
Mm-hmm.
using that experience, and you can use your exams. So basically, I'll explain it in a simple way. So if you've got
Okay.
clinical experience in Pakistan, and if your clinical experience involved working in emergency departments in Pakistan, and if you have got your membership exams sorted out, your MRCEM exam sorted out, then you would be able to get a job at registrar level in NHS. Okay.
Okay.
Ideal scenario would be that you have done your MRCEM OSCE and you have the diploma of MRCEM in your hand. Okay, then you
Mm-hmm.
would straight away get a job as at registrar level. But even if you are still pending to have your MRCEM OSCE, but you are done at least at the level of MRCEM intermediate, then you would still be able to get a junior registrar level job in NHS at a non-training level.
Okay. So now let's talk about some of the things for the structuring and the tailoring of CV, because it is the most frequently asked question by a lot of aspirants, because due to situation in Pakistan health system, everybody is planning to go abroad and settle there and work as the doctor there. So can you please tell us that on the both routes, like the Plab and the membership exam, what are the things and what are the basic courses and the audits and anything like that which you think that are very necessary for tailoring of the CV?
Okay, so a very good question. So explanation of this question is very long. It might take me hours.
Okay.
We
Okay.
can have the discussion later. I mean, in very thorough explanation, I can do that. Another video.
Exactly.
Okay, but what I normally tell my juniors now is that focus on the clinical aspects of your CV. Okay,
Hmm.
by the clinical aspects, I mean do not do attachments, unpaid attachments. Study, sit in your exams, and improve your CV and show your competencies by sitting in the Royal College's exams. No matter which
Hmm.
specialty you want to pursue. You want to do medicine, go for MRCP exam. You want to do gynae, go for MRCOG exams. Okay. Clinical attachments have got no role of securing a job in NHS. It's a,
Okay.
it's a very big misconception. I have been sitting with people who are very close friends of mine, who are the ones who are responsible for recruiting people in NHS, and
Okay.
most of them have said the same thing, that the more observerships and unpaid voluntary clinical observerships you have on your CV, the lesser chance is that you will secure a job. I asked them why, and they said that doing observership shows that you were not clinically involved in looking after patients. You were just standing behind and observing and wasting your time. Apart from
Hmm.
that, if you, instead of that, if you are doing hands-on clinical job, rather, no matter where you are in the world, if you're in Pakistan, you're working in trauma centers or emergency departments,
Yeah.
then that has got more weightage. Okay, so be
Okay.
clinical, do not have any gap in your clinical practice, and start sitting in your membership of Royal College exams. Okay.
Okay. Okay.
And then on top of that, if you want to do a small audit, definitely it will have a weightage. The audit can be as small as auditing the cleanliness of your department. It can be
Hmm.
anything. They just want to see whether you know what an audit is. Okay. And then if you, and on top of that, if you can do some life support courses, ALS,
Okay.
BLS, any
Hmm.
course, ILS, easily
Okay.
available online. Okay. If you can do these courses, and on top of that, if you can do a couple of online courses on radiology or ECG, very basic things,
Hmm.
which can you can easily do those courses and get a certificate from online resources. Okay. So focus on that clinical aspect of increasing your competencies rather than doing observerships and stuff.
Okay, okay, got it. That's a very wonderful answer and a wonderful explanation of this question. because you were very correct that it is a very big misconception, and I'm also the person who thinks that like by doing clinical attachments and observership thing can boost the chances for securing a job. So thank you so much, Dr. Taimur. I think we have a live query, and let me check the query as I'm okay. So we need to do Plab before MRCEM, or we can attempt MRCEM without that. So Dr. Javeria Asad is asking, and I think that Dr. Taimur has already explained it, but please, Dr. Taimur, repeat your words so that she may be satisfied with the answer.
Yeah, so MRCEM has nothing to do with you being GMC registered. You can be in any part of the world, and you can sit in a MRCEM exam without having a GMC registration. But having an MRCEM exam can help you getting a GMC registration. I can explain that too if you want. But Plab is not an eligibility requirement of doing MRCEM exam.
Okay, so I think she must be clear now. And then there is another query by Azka Khan, and she's asking, is OET or IELTS mandatory prior to the exam?
Not at all. They are mandatory if you want to register yourself on GMC register
Mm-hmm.
using the MRCEM route. Then it is mandatory, but otherwise it is not. But having said that, when you sit in your MRCEM OSCE, they need to see your English speaking and communication skills. So for the sake of learning, if you want to sit in your English competency exams, then you're more than welcome, but it's not an eligibility criteria.
Okay, so Dr. Tamur, as we know that the OET and the IELTS, these exam English language tests are only valid for 2 years. So
Hmm.
do you think that it is advisable to take the language exam along with your OSCE exam?
So for the sake of learning, as I mentioned before, just before you sit in
Okay.
your OSCE, I would advise, because I have seen many international medical graduates failing the OSCE just because of their poor communication and English speaking skills. And while you are preparing for your OET and IELTS, I know everyone wants to get OET and IELTS done for the sake of GMC registration, but it
Mm-hmm.
also helps you improving your English speaking and communication skills. So if you are doing OET and IELTS, not just to get bands, but also to learn something out of it, then I would recommend that you do it before OSCE, because it will help you pass your OSCE. Otherwise,
Okay.
eligibility criteria.
Okay, so now another query has been resolved, and now the Emma Chaudhary is asking, working 5 years in primary and secondary emergency department counts?
Definitely, anything counts. Anything at all counts. But you need to be clinical. Okay,
Mm-hmm.
you need to be clinical. If you are not doing clinical things, if you're not seeing patients, to be more
Mm-hmm.
precise, then it won't consider then your CV won't have that weightage. Okay,
Okay,
if you're doing administrative job, then it won't have any weightage in securing your first job in NHS. Okay, so you
okay,
need to
okay,
be seeing patients physically at any level, primary, secondary, tertiary, any level at all.
okay. So now, Dr. Temur, I want to ask few personal question, like which thing provoked you to try for the UK? Why UK, not any other country?
Why UK? Because it's closer to Pakistan, and it feels like
I
Pakistan.
knew the answer, but I was just to confirm, like
Uh,
which was the thing which provoked you to move for UK?
so when I was in my med school, there was a time when I wanted to go to US, and I was preparing for my steps.
Okay.
Then I started doing a government job in a DHU hospital in Pakistan. And my friends
Mm-hmm.
in the DHU hospital, and I'm very thankful to them, they introduced me to Plab and everything. I had no idea about this route back then.
Okay. Okay.
And so they told me they were preparing for IELTS back then. So I asked them what they are doing, and they said, "Okay, there's another route, Taimur. You can take Plab." And then I realized that the residency and the training program in UK is possibly, I wouldn't say it's much better than US, but I would say they are equivalent to what they teach you in US. So you are as good as a doctor in US
Okay.
if you're training in UK. So I said, why go all the way to US and stay away from the
Yeah.
family? And I absolutely love Pakistan, and I love to come back to Pakistan, and I do travel very frequently to Pakistan, uh,
Okay. Okay.
my friends and family. So if I were in US, then obviously I would have been stuck there. But while working in UK, I have the liberty of going to Pakistan whenever I like.
Okay, that's a brilliant answer. Okay, Dr. Taimur, now please comment few words on the life in UK. Being a Muslim, being a Pakistani, what do you think that is the life worth living there?
Oh, life is worth living anywhere in the world. It's not the UK. So,
Okay.
if you are asking about is it comfortable living there, then yes, it is very comfortable. UK is a very Muslim-friendly country. It's a very South Asian-friendly country. Um, but it also depends where you are living. So UK is
Mm-hmm.
massive, and some areas have more Muslim population as compared to other areas. Some areas have more Asian and South Asian population. So what I usually recommend is while you are settling down in UK and while you are working on your communication and social skills, try to settle down in an area where there are more South Asian or Muslim population livings, and it will help you settling down in your early days. And once you have settled down for a couple of years and you have improved your social skills, then you can go wherever you want and you can live comfortable life there.
Okay. So, Dr. Taimur, there is another live query. Adnan Sattar is asking, running a private clinic does count in experience to cover a gap?
As I said, you should be seeing patients. Even if you're seeing
Okay.
patients
Yeah.
in a GP clinic, you can still make that count. Okay?
Okay.
So
So
now,
it doesn't matter like your job is even private or the government one.
not at all. Now,
Okay.
I have helped a few people securing a job while they were working in GP clinic. But what I recommended them is to keep a personal logbook. Okay?
Okay.
So you can always keep a personal logbook if you're working in your own general practice. Okay, in Pakistan or India, wherever you like. Okay, so
Mm-hmm.
you see like 50 patients a day, for example, if you've got a good doctor, if you are a good doctor, and out of those 50 patients, make a logbook and keep data of like 5 patients that I've seen pneumonia
Okay.
today, and this was the presentation, and this is how I treated. And you can always
Okay.
use that to prove that you are clinically working and you're competent and you know what you are doing.
Okay, that's a wonderful tip, Dr. Taimur, I must say. Okay, now let's have some words about the pay scale of the doctors working in NHS on both the routes. Like people want to ask about those doctors working on Plab and those who are working on by the membership route. Who is earning more?
Of course, I mean, registrars are earning more money than the senior house officers because that is how the
Okay,
hierarchy is in the medicine. Yeah. So,
exactly.
but I wouldn't say that we are earning mm, massive amount of money as compared to senior house officers. But yes, our salary is more than senior house officer. So if you are entering at an SHO level, then your
Mm-hmm.
expectation would be that you would get, if you are also doing on call, then in NHS, and if you're working in emergency department, I don't know about other departments, but in emergency department, if you're doing on calls and you're working full time at an SHO level, your salary would be somewhere around 50,000 to 58,000 pounds annually. Okay,
Okay,
that is before tax. Okay.
okay,
Okay, and if you're working at a registrar level, then your salary can be at anywhere between 60,000 to 80,000 pounds annually.
okay.
Okay, depending upon how senior you are and how much clinical experience you have got. Okay, so but everyone should understand that there are a lot of taxations and everything on top of that salary.
Yeah, yeah.
But that's another topic. But having said that, at the end of the month, you will have enough money to support yourself, your family,
Mm-hmm.
and to enjoy your life. I wouldn't say a very luxurious life, but a moderate
Mm-hmm.
luxurious life in UK.
Okay,
You
yeah.
would be able to save some money and send home to Pakistan your families too.
Okay. So, Dr. Jamul, can you please tell us about the hospital timings and the working hours of the doctors in NHS?
Yes. So again, I can tell you about the emergency departments.
Mm-hmm.
Like everywhere in the world, the only thing that is not good about emergency department is the rota. So our
Okay.
rotas are quite haphazard because that is understandable that our rotas would be haphazard because we are the front line people,
Yeah,
and
exactly. Exactly. Everyone knows that.
we cannot shut down our services no matter what is happening in the world. Okay.
Yeah.
So there are a certain number of doctors who have to be present in the A&E department for it to
Mm-hmm.
be functional. Okay. So the rota timing can be anything between 8 to 5. That is a normal morning shift, 8 to 5. Okay, if you are working as an SHO, it could be 8 to 6 if you are working as a registrar level. Okay, so we do an hour extra than SHOs. Okay, and then then there would be some odd timings, like I've got a shift that is from 1 o'clock in the afternoon to 10 o'clock at night. Then there is a shift that starts at 3 o'clock in the afternoon and ends at 1 o'clock in the morning. Okay, so you will have very
Okay.
haphazard rota if you're working in emergency departments. Okay,
Okay.
but if you are working in other parts of NHS where there are no on calls, or like if you're doing clinics, if you're doing medicine, dermatology, hematology, or whatever, then your job would mainly be 8 to 5 every day, Monday to Friday.
Okay. Okay, so that's a wonderful elaboration as well. Okay, Dr. Taimoor, there is another live query, and Dr. Salman Arif is asking, what do you prefer, CESR or ST1 route, and why?
Okay, so they're asking about CESR route, and
Yeah, exactly.
yeah, so CESR route. So okay, so like most specialties in UK, you have an option to register on the specialist register using two different routes in emergency medicine. The first one is that you do a formal training program, and at the end of that formal training program, you get CCT. Okay, and that formal training program will make you rotate in different hospitals in different specialities according to your curriculum. And at the end of that, you will get a certificate of the completion of training, that is CCT, and then you will be on a specialist register.
Okay.
The other method is that you do not enter into a formal training program, but you locally start working in a hospital that supports non-trainee doctors and trains non-trainee doctors, but locally. Okay, as a and you pursue your career as a non-training doctor, and while you are working in that hospital, in that trust, you keep collecting your competencies, which would be similar to the competencies that the trainees collect. You maintain a portfolio which would be similar to the portfolio of a trainee. Okay, and then you keep sitting and passing your exams. At the end of 5 to 6 years, if you have got all the competencies covered, if you have got all the exams passed, then you can use those evidences to apply for a registration on the specialist register on the CESR or CSER route. Okay,
Okay.
both of these routes are doable. Both
Mm-hmm.
are absolutely doable. If
Okay.
you are in a training program, it's a very straightforward route. But if you are not in a training program, but you are well supported by your senior colleagues and your hospital and your trust, then you can still get a registration using CSER route. Okay, so they are both
Okay.
good, and they have got
Okay.
both equal weightage.
Okay, thank you, Dr. Taimoor. So there is another live query by Adnan Sattar, and he's asking how many hours per week and how is working environment working as a registrar. I think he's asking about the working hours and the working environment as well.
So the weeks can vary, my friend. They can be somewhere between 40 to 48 hours a week. Okay, but never less than 40 hours. Okay,
Okay.
this is your basic job. Okay, so this is what you have to do. This is what their contract would say. Okay, 48
Mm-hmm.
hours max, but it could be anywhere between 40 to 48 hours. On top of that, people like to do locums because they are heavily paid, and that
Mm-hmm.
depends on your own ability, how many extra hours you can do every week, and you will be paid quite heftily for it.
Okay. So there is another live query. I'm glad that I'm having a lot of queries and I'm taking much more time from you.
That's
So Safa Ikram is asking how much time is required for the whole MRCEM preparation. Like I think she's asking about whole three parts.
okay. So so as I said, primary is, I think, the most difficult part. In so it will take you 6 months. If you are clinical, then it will take you 3 months to prepare for your intermediate exam if you are good with your clinical knowledge. Yeah. For OSCE, completely depends on your communication skills and how much exposure you have in emergency departments. OSCE is slightly difficult and slightly different for different candidates. Okay, for me, it was very straightforward. It took me 1 month because I am
Okay.
working in NHS and I've worked on
Mm-hmm.
my communication skills while working in NHS, and I'm well
Okay.
versed with how the department runs in an NHS. Okay, but if
Okay.
you are not working in NHS, then it can take you somewhere around 3 to 6 months.
Okay. So I think it has been cleared. Now there comes another query by Zuhaib Shafiq, and he's asking if there is a gap after house job and start of new job, etc., or somebody was struggling for job adjustment, etc. Can he or she still try for this Plab or MRCEM route?
Yes, so the GMC guideline is different. If you're talking about getting GMC registration in UK, then any clinical gap, no matter how big it is or small it is, need to be justified. Okay, if
Okay.
you've got a very clear justification of it, for example, if you can say that you were on maternity leave, for example, if you,
Mm-hmm.
if you can justify it, or if you can say you're having financial difficulty, then you can justify it, or you can say that you were unwell, or is there
Mm-hmm.
if you've got a justification of that clinical gap, my friend, then nothing will cause trouble. But if you don't have a
Okay.
justification and you're just sitting at home watching Netflix, then obviously GMC would cause trouble for you.
Okay. Thank you again. And Dr. Salman Arif here again, and he's asking to enter from ST3 is really difficult as a lot of people don't have good experience. Why it is so difficult to enter from ST3?
Okay, so ST3, it is difficult because they, when you are putting your application for ST3, which is also known as Dream Pathway, okay. So if you are putting your application for ST3, then they expect the guy who is
Mm-hmm.
reading your application and triaging your application would expect that you have enough competencies of a doctor who is already working at ST3 level in NHS. Okay, so
Okay.
if you know what those competencies are, and if you work on those competencies and gather evidences about those competencies, then it would not be difficult for you at all. Okay,
Okay.
so now Royal Colleges have made everything very easy and accessible
Mm-hmm.
to everyone. If you do a simple Google search and you search for the checklist of competencies of ST1 and ST2 or
Mm-hmm.
CT1 and CT2 in emergency medicine, then a checklist would come. It's a downloadable checklist.
Okay.
Go through that checklist
Okay.
and see what are their expectations. The checklist might include chest drain insertion. It might include
Mm-hmm.
basic surgical skills. It might include communication skills, prescription skills. So if you start gathering your evidences against those competencies, and then you put your application forward, then no one would say no.
Okay. So the last type query is Adnan Sattar is asking which area in UK would you suggest for a Pakistani to settle and which trust would you recommend?
Okay. Okay. I don't have a lot of experience working in other parts of UK. I've always worked around London area, and London
Okay.
is a beautiful place. It's a
Yeah,
very
everybody knows that.
it's a very peaceful and a South Asian friendly place. So I would definitely recommend that if you are trying to land your first job in UK,
Mhm.
get it somewhere around London area, and you'll be much more comfortable to settle down.
Okay. So, Dr. Temur, what do you think that it is not related to your specialty? I'm asking about the journal overall specialities of the medical field. Which specialty has better chances to secure a job, your first job in NHS right after Plab?
Straightforward answer: emergency medicine.
Okay.
I'll tell you why.
So,
Tell you
yeah.
why. Emergency departments are heavily short-staffed in NHS. Not only
Mm-hmm.
NHS, all around the world, there is a shortage of emergency doctors, good emergency doctors. Okay, so if you consider yourself as a good emergency doctor, then you would definitely get a job in A&E of anywhere in UK. Okay, so our A&Es are full of locum doctors who are working there because they have vacancies available, substantive vacancies available. Okay, so if you try and target those jobs, then you'll be able to get your
Mm-hmm.
first job easily.
Okay, so thank you so much. Okay, I have taken much more time, your precious time. So the last thing is, you are having any message for the upcoming aspirants, for the juniors? Please let us know that what are your thoughts about them.
Okay, so my first message, and I think the only message is, as I said before, try to be as clinical as you can. No matter
Okay.
where you are based, what you are doing, try to keep gathering competencies of your clinical work and evidence of your clinical work. Okay, and then try to gather as many competencies as possible for that specific specialty that you want to work in. Okay, let
Okay.
it be emergency medicine, let it be whatever. Okay, so
Okay.
and to get hold of those competencies, it is the checklists of every level of training is available online. Go through those checklists, make up your mind, and then come to UK. Okay.
Okay.
Having said that, be a bit flexible when you come to UK. Okay. If you are very if you think like you will become a cardiologist when you come to UK and you are only coming to UK to become a cardiologist, then my friend, you won't succeed. You need to have
Mm-hmm.
an open mindset when you are coming to UK. You try and to do as many non-training jobs in UK as possible to get as
Mm-hmm.
much exposure of different specialities as possible, and then make up
Okay.
your mind that what is suitable for you as a doctor and as a human being.
Okay, thank you so much, Dr. Taimoor, for your gracious presence today, and I'm heartily thankful to you for this, for your time in such a busy routine, and thank you all the viewers. And this is the whole big thank you from the MedExam team. And if you guys still have any queries regarding any of the membership exam, fellowship exam, you can contact us, the team MedExam expert. And for those students who are asking about the OET and the language test exam, I myself is the OET mentor at the MedExam and also official mentor of OET. So you can contact us right now. The team can provide you the guidance. And thank you so much. Once again, thank you so much, Dr. Taimoor.
Thank you so much for having me on the show. Thank you.
You're welcome.